Hi, I am Dr. Hiranmayi Jha and today I am talking about hair transplant procedure. Hair transplant is a surgical procedure wherein hair is taken from the back of your scalp, which is the permanent zone, and transplanted in the areas which are bald. Male pattern baldness and generalized thinning in females. Both patients are the candidates for hair transplant procedure. So what are the techniques that we do? There are two techniques and both the techniques have proven to be equally successful. FUT or the strip method, in which a strip is taken from the back of your scalp and then it is closed with sutures and then individual hair follicles are extracted. In the FUE method, punches are used to take out individual follicular unit from the back of your scalp and then they are implanted in the previously made slits in the areas which require transplant. Now the question which comes to your mind is, what are grafts and what are follicles? This is the question that has been asked by so many patients, and I want to clarify today that a graft is a single unit that we extract from the back. It can contain a single hair follicle, double follicle or triple follicles. And graft and follicles are not the same. Another thing to be highlighted is not all patients need the same amount of grafts. It depends upon the area of baldness and the stage of grade of baldness. Suppose this patient has baldness in this area, which is the hairline, and both the sides, if this patient has a frontotemporal recession as well as decreased amount of hair in the crown part. So the amount of graft or amount of hair follicle which is required to cover this area is different from the amount required to cover this area, as the density varies in these parts of the scalp. So you have to make it clear in your mind that whenever you consulting your surgeon, the number of grafts that will be required to be transplanted will vary on these factors. Now the question which comes to your mind is, will the results be permanent? Yeah, the results are permanent, but you have to follow instructions of your surgeon. You have to follow a few protocols in the post-operative period, which include using oral supplements, some serums to be applied so that the area which has been grafted have native hair as well. And although the transplanted hair do not suffer losses in the post-operative period, but your natural hair which was there from before can suffer hair loss. So you have to maintain that to make results more permanent. Now what are the side effects of hair transplant procedure? So side effects include, there can be swelling which is mechanical and gets resolved in 2 to 3 days. Another thing is some amount of itching, scabbing or some pinpoint bleedings, which is taken care of comfortably. What are the aftercares? You have to apply some antibiotic ointment over the graft donor area. You have to shampoo your hair daily, avoid wearing helmets, avoid hair dyes and any too much sun exposure during the period. You can start your offices in 3 to 5 days and you can start your cardio exercises by 10th day, and 3rd week is the period when you do your heavy and strenuous exercises. I hope this amount of information is okay for you, and if you have any queries related to the topic, please write to us in the comment section below. And we will be making more videos regarding hair transplant and hair fall in order to make you aware of what are the do's and don'ts before you go and opt for these procedures. Thank you.